The federal government sending emergency medical teams to Minnesota to deal with one of the country's worst COVID outbreaks. Hi, everyone. I'm Amy Hockert.
And I'm Kelsey Carlson. Theo Keith is outside of HCMC tonight. So, Theo, that's one of the hospitals that will get this federal help.
Yeah, the Department of Defense team, which has 22 members, is supposed to arrive here next week. Another team is going to St. Cloud Hospital. Governor says these staffers from the federal government are going to be able to step in immediately and help doctors and nurses, but they are just a fraction of what's needed.
When two federal emergency medical teams land in Minnesota next week, they'll be in one of the country's biggest COVID hotspots. Minnesota hospitals have 400 more COVID patients just since the start of the month, a 40% increase. Health officials said more hospitals have asked for federal help, but the feds could only spare these two teams.
A lot of the bed shortages are not physical beds. They're just simply not enough staffing available.
Dr. Randy Rice is a family medicine physician in Moose Lake and president of the Minnesota Medical Association.
It's doubly frustrating for most of us because we really have the tools to put this to bed.
Meaning vaccinations. Governor Tim Walz, speaking to reporters from Finland, where he's on a trade mission, called the situation a crisis, but said he has no plans to call a new state of emergency. He said there would be political fallout, including that Republican lawmakers could fire his health commissioner. Practical considerations. Some wouldn't wear a mask even if he mandated it. And he said it's false to think calling an emergency now would bring Minnesota's death rates down.
So it's not a matter of it gets bad that you do this or you're avoiding do it because of politics. It's just not that effective of a tool right now.
Healthcare professionals say personal responsibility like getting vaccinated and wearing a mask is needed. But some say the situation calls for renewed mandates.
Having mandates, at least in crowded situations, I think the schools, it's needed. Schools are one of the big places we're seeing the spread now.
In addition to these federal emergency medical teams, the state is also opening up a third hospital discharge site in St. Paul. It's going to take in patients who leave Twin Cities area hospitals, but there aren't any beds available at long-term care settings for them. Like I said, it's the third such site to open. We're told more of them are in the works. Live in Minneapolis, Theo Keith, Fox 9.